Hello and welcome to Getting Your Money's Worth, the show that focuses on value. I'm Judith West, and our guest today is Dr. Rackow, CEO of Senior Bridge. Hi, thanks for being on the show, Eric.
My pleasure.
Okay, before we go into Senior Bridge, you've been in this medical industry for a long time. You're still a professor of medicine at, is it NYU School of Medicine?
NYU School of Medicine.
Yeah. And you were with president of the New York Hospital Association, so you've been around a long time. I'm happy to see that you're still passionate about it. Yeah. It's a much tougher industry than it used to be, right?
It is, Judith, and I spent over 35 years in hospitals, and what I learned was that, in fact, the best way to care for people is outside the hospital.
Right. I don't want to get down on hospitals, but there was a George Scott movie, like send them home before something bad happens to them.
Right.
I mean, I was thinking the best way to stay healthy is to stay home, which is a very good segue to what you do now.
Correct.
You're CEO of Senior Bridge. Okay, it's Senior Bridge, so that in itself tells us something. What is Senior Bridge?
Well, Senior Bridge is a care management company that enables senior citizens who have chronic illnesses to stay at home safely, to not have to be placed in a nursing home, to avoid hospitalization. And so it's a bridge to having seniors live the kind of life they like to live at home.
Okay. And now, you have a very big plate. This is a mighty task, a big task, because when you talk about seniors, I mean, you really, in reviewing your population, your climate, you really have folks who are, I mean, not only physically sick, but you deal with dementia, Alzheimer's, Parkinson's. I mean, it's a very difficult population to keep at home, isn't it, Eric?
It is, and it requires a lot of skill. As you know, there are over 40 million Americans over age 65. And the older we get, the more disabilities we develop. So what Senior Bridge does is it employs professional care managers who are licensed nurses or social workers and integrates our home health aide into that care management team so we can provide the kind of care coordination at home and support so people live longer, stay healthy, and stay at home.
And I have to say, this sounds wonderful. Having visited family members in assisted living or nursing homes or whatever the euphemism is for these places, there's a certain kind of appearance about most of them. But on the other hand, I don't understand. Explain to me how you ensure the quality of care when you have your folks dispersed over so many different environments.
Well, first it starts by hiring the best. So we are very selective in who we bring on board as our care managers, either nurses or social workers, highly trained professionals.
Well, do they move in or they visit?
Well,
what do they
do? They visit. So, and what they do is they go in and assess the patient's needs, and they provide the care coordination, make sure they have the right medical care, social support, nutritional support, and they supervise the home health aides that stay in the home. And those home health aides are very carefully selected, trained, and supervised by our care managers so that we have a comprehensive way of taking care of people at home.
You know, I live in a large apartment building in New York City, which has mainly an aging population. I have to say, I've heard some really nasty yelling and things like that. You know, if I go out, my hall's a small hall, but I mean, I've seen a couple and heard a couple of things, and I have friends that tell me some horror stories. This can't be new to you. What is it that you do different to prevent this from happening?
We select the people who are really appropriate to care for our clients. For example, we will get about 20 applications for home health aides. We'll interview 4 or 5 of those, and we may select only one of those 20 to work at Senior Bridge. Then train them, then supervise them with our care managers, make sure their competencies are up to date so that they're really providing the kind of care. It is true that when you look at the whole industry, and especially if a family hires somebody privately, there's no guarantee that they're screened properly or trained properly.
In fact, the worry always is mom or dad or receiving good care and not being abused in some way.
Correct. And in New York State, as well as most other states, licensed home care companies, of which we are one, have to meet state regulations. They're surveyed by the state. We do our own internal audits, so we quality assure that we have the right people who are trained properly and make sure they provide the care.
You know, this sounds good, Eric, but it sounds very pricey, this high level of care and management. You have just a very rich client base. Who pays for all of this?
Well, unfortunately, as you know, Medicare does not pay for long-term care.
Right.
So that's a problem in our health care construct, and hopefully the new administration and the Obama health care plan might address this. But at the current time, Medicare does not fund long-term care. So that is paid for privately. Now, many patients have long-term care insurance. About 15% of our clients actually have long-term care insurance. But it is private pay, since Medicare does not cover this particular type of care.
So if you're under Medicare and you can't afford to pay for another service such as yours, you have to go into some kind of a facility.
Well, that actually is the same problem, because in facilities, Medicare, again, doesn't pay for long-term care. Let's take a nursing home. So Medicare doesn't cover nursing homes. So there are really two options, either private pay, which is a significant part of nursing home population, or if you can't afford care and you fall below a certain level of economics, Medicaid does fund long-term care.
Medicaid.
So you have to be eligible for Medicaid, but in this country, only about 19% of our population is Medicaid eligible.
So it seems like there's a big piece of our population that is tottering between the crack and security.
Right. And what usually happens there, when someone can't afford that kind of care and is not eligible for Medicaid, then the family member becomes the caregiver. And that's a very big burden on families.
And that's a very big, and also I think where the quality of care has a tendency to diminish.
Right. And so one of the things that we're trying to do, as well as others, is to think about ways to support family caregivers, to educate them, to give them emotional and psychological support, because much of the care, if someone cannot afford to pay privately, is actually by family caregivers.
Right. You know, I read recently by a company that, by a survey, I forgot what the survey was called, Americans something, long life, that it's projected in not that long a future from a date where 50% of Americans are going to be old enough to qualify for some kind of senior health care.
Right.
Your population is exploding.
The most rapidly growing segment of the population are older adults, older than 65, and especially older than 85.
Right.
And as you get older, you develop more disabilities, and therefore the care that's needed is going to explode. For example, people over 85, 50% of people over 85 have Alzheimer's. They need special care. So as the population ages and as disabilities become more prevalent, society is going to have to deal with how to handle chronic care outside of facilities.
Right. You know, I've read and I've been told that folks, even 85 and older, benefit from social interaction,
right,
from friendships. It obviates or dilutes a lot of some of this age-related dementia. Does your organization provide opportunities for, one of the things I see about some kind of facility, at least people are with other people. They have social events or they have their meals together. It seems like your client base staying in the house with a home health aide would be very isolated, Eric.
Well, that's a very important issue. So what we do is we try to make sure our care managers look at the whole picture. It's just not medical care or nutritional care. It's socialization. Take the person out. Some people are able to go to the movie or an opera or to attend a social function or to have friends down the hall or down the block. So our care managers make sure that we're providing for socialization. It is true in facilities you get some of that, although it's very institutionalized. Right. So we much prefer to be able to provide socialization in the person's own home.
It sounds good. Okay. So these care managers that you talk about, that's the level above the individual home care aide. Now, some folks require live-in, and some don't require live-in, right?
Correct.
Yeah. I suppose you decide that based upon mental competence or physical ability?
Exactly. So the care managers, the licensed nurses and social workers, evaluate the person. Some may need 4 hours a day, 8 hours. Some need 24 hours a day. And it depends on their functional level of ability and their mental level of ability, both of those things.
And how many houses or individual clients does a home care manager cover?
The care manager covers, it depends on the complexity of the individual.
Yeah, this sounds like an urban setting.
Right.
I want you to help me understand, because I like the idea very much. That's why you were invited on. But it sounds like very complicated to me.
Well, it is. It is very. You really have to have a highly developed approach to have care managers be able to do this, especially integrating nursing and social work, the clinical aspect and the psychosocial aspect. Each care manager usually handles somewhere between 10 and 20 clients. If they're very complicated and very complex and need a lot of care management per week, maybe it's down to 10. If they're a little less complicated, maybe they can handle 20. So it's all related to the level of disability the person has. So this is an approach whereby you have to have highly trained professionals. And by the way, we also supervise our care managers. We have a director of clinical services in each of our offices that supervises the care managers, reviews their charts, reviews how the client is doing, how the family is involved, to make sure we're providing the care we need.
How many years have you been in business?
Senior Bridge has been in business since year 2000.
Okay, so you have you've got to have a history of track record.
Right.
How much does services like this cost?
Well, depending on the level of disability, it could cost anywhere from about $2,000 per month up to $10,000 per month. The average is about $5,000 per month.
Okay. You know, what is it? How does that compare to the cost of someone being in a facility?
Well, let's look at New York City.
I'm sure you must have done these numbers because
course.
you talk. That's what you do for a living.
And we have to discuss that
and
with
you
our
have
clients.
to discuss it exactly.
Part of care management.
We only have a couple of minutes, but give me a frame of reference.
Yeah. So it's very important for clients to understand this. So in New York City, say the average client is $5,000 a month. That's $60,000 a year.
Okay, that's $60,000 a year.
A nursing home costs over $140,000 a year in New York City.
So you're saying to me, allowing a loved one to stay in his or her own home and having this kind of individualized care is about half the cost of a facility.
That's correct.
Well, that should get some attention.
And that does when you explain it to your families and your clients, that they can stay at home, they can have individualized, not aggregate care in a nursing home. After all, aides take care of a number of patients on the floor. But individualized, customized, personal care at home, and it's actually less costly than a nursing home. Was this your idea? Did you find this from the beginning? No, Larry Sosnow has been the founder of the company, and I got interested in this because of watching in the hospital how many times people with chronic illness come in and out of the hospital. Yeah, it's like a revolving door. We call them frequent flyers. Frequent flyers. It's a revolving door. And this is really the burden Medicare has in terms of health care funding. So we have to solve this problem and let people stay at home. Well, I have to say I was at first skeptical about having you on because there are plenty of horror stories, like anything else for that matter. But when I saw your credentials and pedigree and I read about you, it made me believe that you had something to offer that we wanted to highlight on getting your money's worth. So that's why I thank you for being on and explaining this to us. It's Senior Bridge. We have your website up on the screen, and we'll make that available. And I want to thank you for being on the show. You helped, I think, clarify some things that I had in my own mind. So thanks for being on. Thank you very much, Judith. You're watching Getting Your Money's Worth. I'm Judith West. Thanks for watching.